remember waking up to Dr. Kolb standing by my side saying, "Catherine, you're not gonna believe this. Both of your implants were black."
At the start of her modeling career, Catherine had breast enhancement surgery.
I went from a 34B to a 34D.
I'm a real plastic surgeon. I do a lot of breast augmentation surgeries, and this is a very common size increase, B to a D. Now, breast implants come in two different varieties. They're saline breast implants. They're basically silicone rubber shells filled with saline, and we fill the saline ourselves as plastic surgeons. Or there are silicone implants that have an outer silicone rubber shell, like the saline, but inside is not saline solution, but it's actual silicone gel.
I started to feel like I had low-grade fevers, and I would get very bad headaches, and I could feel a heaviness in my chest where it actually felt scratchy.
So she's got an issue with her implants. She's having low-grade fever. She's having kind of a scratchy sensation, firmness of her chest. Does she have an infected implant? Well, infected implants typically occur relatively early on in the healing. Now, my understanding is that this story that she's telling is at least a year, if not a couple years after her implants were placed. So it's very unusual to get a late onset infection like that. Another concern would be capsular contracture. Capsular contracture is thickening of the scar tissue around the implant. Every implant that we put in the body, our body will create scar tissue around it. And in certain cases, that scar tissue can get so thick, it can become hard, firm, and it's called a capsular contracture.
I said, I'm having pain and numbness in my arms and legs, fatigue. She told me I had fibromyalgia.
Fibromyalgia is kind of a catch-all term for a number of symptoms that some people can get that include just what she describes: chronic pain, fatigue, unusual symptoms like neurological symptoms.
You've gone to doctor after doctor after doctor, Catherine, and they keep telling you there's nothing wrong with you. I felt hopeless. I felt so alone.
So initially we talked about capsular contracture, we talked about an infected breast implant. Now she has seen many, many doctors. Nobody can figure out what's wrong. It sounds like she may be dealing with breast implant illness. And this is a constellation of symptoms that some women get, we believe, due to their breast implants. Now, unfortunately, there's not a whole lot of science that we have about them. I do believe breast implant illness is real, and the treatment typically for breast implant illness is to take out the implants. Now, if you think you may have breast implant illness, I actually did a video with one of my patients who had breast implant illness where I took out her implants. You can take a peek at that video right up here and see how she did after her implants were removed.
She called and said that she was having symptoms of fibromyalgia, symptoms of neurological problems.
This plastic surgeon, Dr. Susan Kolb, wrote a book about breast implant illness that was published way back in 2010. And that made her a little bit of a pariah in the plastic surgery community because at that time, breast implant illness was not something that most doctors honestly believed in, most plastic surgeons believed in. Well, since then, times have changed, and more doctors like myself do know that breast implant illness is real. But unfortunately, there is no way to truly diagnose breast implant illness other than taking a patient's implants out and seeing if she feels better afterwards.
72 hours later, she wheels Catherine into surgery.
And we go to the scar tissue around the implant. Then we opened it up and took the implant out.
There are a lot of ways to remove a breast implant. Some doctors will make the incision and then just remove the implant and then basically close the incision up. Other doctors will perform what's called a capsulectomy. A capsulectomy is when you remove the implant along with the scar tissue surrounding that. In most breast implant illness cases, when patients are really concerned that these implants are making them sick, most doctors, myself included, will remove the implant along with some, if not all, of the scar tissue surrounding it. But there is a belief amongst a lot of patients that if you don't remove that scar tissue, the patient may not get better. Well, recent studies, which are quite small, appear to show that removal of that capsular tissue, that scar tissue pocket, is not necessary for a patient's symptoms to improve. So the science is rapidly changing. We're getting more and more information literally by the month.
I remember waking up to Dr. Kolb standing by my side saying, "Catherine, you're not going to believe this. Both of your implants were black."
Both of her implants are black? I've done a lot of breast implant surgery. I've removed a lot of saline-filled implants, but I have never seen one completely black. Now, I have seen one case, maybe two, where a patient's doctor injected betadine into the breast implant. Betadine, as you may know, is basically iodine antiseptic solution. And the belief by apparently, I think the doctor that put the implants in was that if they inject a bunch of saline into the implant and they throw some betadine with it, that betadine can prevent the implant from getting infected. Well, the problem is that betadine should not be necessarily put inside of your body in that way. There's no evidence to show that that's beneficial for the patient, and it may even potentially break down the implant shell. So this is something that may have been practiced by some doctors, but really isn't common practice. What else can cause an implant to go black? Well, mold.
I couldn't believe it. I was disgusted.
There are isolated reports of people who supposedly get mold in their breast implants. Now, I have removed literally thousands of implants from people, and I have never seen an implant with any obvious mold in it. I told you about the betadine-filled implant, but mold I have never seen.
I knew that the implant was making her extremely ill. It was black with particles floating in it.
So how would an implant grow mold inside of it? Well, I put a lot of thought into this, and when I first started my training back in 1998, I worked with an old school plastic surgeon, really good doctor, but old school surgeon, where he would fill the saline implants up using a bowl of sterile saline solution.
Just nice and lightly.
That was on the back table. Essentially, he would have a big sterile bowl in the back. The nurse would then pour sterile saline solution into that bowl, and then when he was ready to fill the implant, he would take a sterile syringe, pull the saline out, and then inject it into the implant. Well, the fact is that that bowl of saline solution was sitting on the back table, sometimes for 10, 20, 30 minutes, or maybe even more. It's definitely possible that during that time you could have dust particles fall from the ceiling into that saline solution. You could potentially contaminate it just by your gloves, by potentially the bacteria and even viruses and fungi that may be sitting on the surface of the skin. Who knows? When you're in the operating room and you have the big lights above, and if those lights bang together, you can actually see dust particles fall from those lights, sometimes onto the patient as well as onto the back table. So having this bowl of saline sitting in the back doesn't necessarily mean that it's without any type of possible contaminants.
Good soup.
Now, he was the only plastic surgeon, the old school doctor that I saw that would fill saline implants that way. Every other surgeon that I trained with after that, and this is how I do it in my own practice, we take saline directly from the bag of sterile saline, the same type of saline that would go into an IV if you're sick, and have that go directly into the breast implant. That way there's no risk of any contamination. So it's possible that these isolated cases of mold inside breast implants may be due to that old-fashioned technique of drawing up the saline that's on the back table and not doing a closed system going from the actual IV bag into the implant.
Whatever is floating inside that dark liquid has been poisoning Catherine for months.
The major fungus found inside her implants was Aspergillus niger.
I think that's like black mold. My understanding is that that is a type of fungus that's found in wet surfaces like in your shower.
But how did the fungus find a way to get inside her implants in the first place?
Catherine developed an infection while she was breastfeeding, and her doctors placed her on antibiotics. However, when you're on prolonged antibiotics, you can get mold and fungal infections, which is what happened to Catherine.
Well, that's kind of odd. I don't know that I would agree with this doctor about that. Now, if you've got a mastitis and you have breast implants, is it possible that you can infect your breast implants as well? I do believe that's possible, but how would mold get inside the implant? To me, I think her hypothesis doesn't quite match. I would tend more towards the back table saline one, in my opinion.
It was really tough. I mean, it took a good month and a half before I felt normal.
Well, I am so glad that she is feeling better after having those mold-filled implants removed. Once again, I've been doing this for a long time. I've heard stories about mold in breast implants. I've never seen it. I've asked some of my colleagues. None of my colleagues have ever seen one with mold inside of it either. But that doesn't mean that breast implants don't come with their share of problems and risks. So she had fungus growing as a monster inside her. What about somebody who has a worm growing inside his eye? Yes. This was an episode of Monsters Inside Me where a guy had a worm inside his eyeball that he could see moving around. You gotta check out my reaction to that story right up here. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.